Let's talk about, we've talked customer experience primarily about sort of the external customers. Let's give an example, if you will, Lisa. I'm going to ask you, Veterans Affairs. There's thousands and thousands of folks inside of the Veterans Affairs that are providing those goods and service and capabilities to those veterans, millions that you've pointed out. They've got to have a good experience as well. Let's talk about that. You want to give us an example?
Sure. And it will not shock anyone that caring for that many veterans requires a lot of healthcare personnel. So among the VA's employees, we have more than 100,000 healthcare providers. It's not news that one of the biggest things facing the American medical system is provider burnout. I think the AMA recently released statistics that more than 60% of physicians are demonstrating some symptom of provider burnout, which of course impacts their quality of life and, their wellness at work, but obviously trickles down to the veterans that they're caring for. So that's something we have a lot of focus on improving, and AI, of course, anything we can do, and AI is definitely one of those tools we're leveraging. Specifically, we're looking at how AI can act sort of as an assistant to those providers. Specifically, that takes the form a lot of reducing the administrative burden, which we know is one of the creators of that burnout. So we've been looking at things like using AI to enable ambient dictation of care interaction. So not kind of this literal transcription, but this dynamic, informed transcription that highlights, patient concerns, requests for tests, prescriptions that are needed, and allowing the provider to, in that moment, focus on the patient, not about taking notes or checking things off on an iPad, really being present with the patient to ensure that they're really making those connections and providing the best care experience we possibly can. And then that functionality, after the appointment, the provider can then review the notes that have been provided and make any changes that they need to make, and then move on to the next patient. So in that application, we're hoping that it will show that it lets providers really focus their energy and time on what really matters most, and lets AI step in to support them in the way that's most productive.